Die eerste geval van die COVID-19 virus in Suid-Afrika is gister aangemeld. Nou president Cyril Ramaphosa meen daar is geen rede tot paniek nie en minister Willem Mkhize meen die situasie is onder beheer. Dr. Owen Kaluwa, Suid-Afrikaanse verteenwoordiger van die Wêreldgesondheidsorganisasie, sluit nou telefonies by ons aan om oor die jongste verwikkelinge rakende die virus te gesels. So good morning and thank you for joining us, Mr. Kaluwa.
Good morning.
Briefly give us some background or confirmation about the first reported case in South Africa, please.
Thank you. Indeed, as you must have heard from the Honourable Minister, Dr. Willem Mkhize, South Africa has reported its first confirmed case of coronavirus disease 2019 or COVID-19. Now South Africa has become one of the countries in Africa, the seventh country in Africa, to have confirmed a case of COVID-19.
Mm-hmm. Now, apparently the World Health Organization is not convinced that the South African Ministry of Health is able to control the spreading of the virus since the World Health Organization's precautionary measurements issued last month was not adhered to.
No, the World Health Organization is quite convinced that the measures that have been put in place are adequate to quickly identify, quickly respond, and contain. Mm-hmm. As you have seen in this particular circumstance, this has happened quite quickly. And we are quite confident that the South Africa has the capacity to do that much better than other countries. And we have been working over the past few weeks with the National Department of Health to strengthen those capacities.
Well, that's very interesting because that's not what we read in one of the news articles, but if that changed in the meantime, then I'm glad to hear that. What should we do to prevent ourselves from being infected?
Well, there are a number of things that people can do to prevent being infected. One of them is regular and thoroughly cleaning hands to ensure that at least your hands are clean enough, because sometimes the infection can go if you have contaminated hands and maybe you rub your eyes and you can get the transmission. So that again requires that we avoid touching the eyes, nose and mouth, mm-hmm. and we maintain at least a distance of a meter or so between yourself and anyone who's having respiratory conditions such as coughing or sneezing. And the other important thing is to make sure that you follow good respiratory hygiene. This means covering your mouth and nose, or when you have to cough on your bent elbow, or use tissue, and then, of course, dispose some of the used tissues immediately and properly. And if you're unwell, it's good if you stay at home. If you have a fever, cough, and difficulty breathing, you seek medical attention. So the other important thing is to stay informed, to stay informed and to follow the advice that is being given by the health providers, your health provider, or the national or local public health authorities. And these are some measures that individuals can take on their own to minimize being affected.
There's also a WhatsApp message going around about a specific hotline. Do you know anything about that?
Yes, there is a hotline that has been set up, mm-hmm. Where people can phone in to get more information that they may need to help them and help their loved ones in terms of if they need more information on what they need to do to prevent being infected. Mm. But that hotline has been set up by the National Department of Health in consultation with the National Institute of Communicable Diseases. But I don't know the one which is going around, whether it's this particular one. But I know that there is a hotline that has been set up by the Department of Health.
And we will give that specific number to our viewers a little bit later. What is the overall current state of affairs regarding this virus worldwide?
Well, the current state of affairs is that there are now over 95,000 confirmed cases worldwide. Mm-hmm. And of these, over 80,000 are in China. and the rest in some 85 countries outside China. And overall, the number of new infections in China are decreasing, but we are seeing spread or increase in new cases in other countries outside China. So far, there have been over 3,000 deaths in China and about 267 deaths outside China. So this obviously is an evolving situation, which WHO is following and keeping the member states informed and giving the necessary advice in terms of measures that needs to be put in place.
Mm-hmm. What is your take on the International Monetary Fund's recent announcement regarding a $50 billion program to fight this virus?
I think this is very good news. And so too is an announcement that has been made by the World Bank and also other partners have made various announcements. This problem of COVID requires global collaboration and global solidarity to ensure that all countries have the capacity to be able to address this problem. Because as long as there is a country where it is circulating, the whole world will continue to be at risk. So indeed, this is good because this will go a long way to help to strengthen countries that may have weaker capacities so that they too are able to do their best to contain or to deal with COVID-19.
Mm-hmm. Mr. Kaluwa, is there anything else that we need to know about at this stage?
At this stage, I wish to say that every country is at risk. However, the world can still control this outbreak. All countries need to put in place appropriate measures to deal with it. And as WHO, we believe that containment of COVID-19 is feasible and must remain the top priority of all countries. Indeed, with early containment measures, countries can slow or stop transmission and save lives. But what is very important, and I want to reiterate or echo what was said already by the Honourable Minister and His Excellency the President, is that there's no cause yet in South Africa now to panic. I think the National Department of Health has put in measures, is following up all possible contacts and having a thorough investigation of this particular case that has been confirmed to ensure that we are able to contain it. So I think there's no need at this moment to panic, but to have a keenness to get all the information about the coronavirus, and that people should begin to practice the various measures that can protect them from infection.
We've got about a minute left, but I would like to refer to the fact that the spreading of fake news on social media platforms is also a big challenge. So what is your take on that? For instance, do you think that people worldwide are informed enough?
I agree with you that the fake news is a big challenge because it continues to misinform the public, and can create unnecessary panic, can also make the public not be able to adopt the appropriate measures that can protect them. There is, at a global level in WHO, there is an effort to deal with all the various misinformation that are circulating, to deal with all those kind of things. And again, in country, that is also going to be one of the major things that we have to do within the aspect of the work we are dealing with. We are working with the Department of Health on the risk communication and community engagement.
Mr. Kaluwa, thank you so much for joining us indeed. Dit was dan Dr. Owen Kaluwa, 'n Suid-Afrikaanse verteenwoordiger van die Wêreldgesondheidsorganisasie.